Healthcare facilities have always been the very definition of mission critical. And like all enterprises today, healthcare runs on timely access to information when and where it's needed. That means wireless LANs are essential here. But just how well does wireless work in a hospital environment? And can wireless LANs meet the non-stop intensive needs of clinical staff, patients and guests, in an extensive and diverse set of applications? I'm Craig Mathias with the wireless and mobile advisory firm Farpoint Group, and welcome to another edition of Farpoint Focus, where we explore the latest developments, products, and strategies in wireless networking and IT mobility. Today we've come to the Western Maryland Regional Medical Center, part of the Western Maryland Health System in Cumberland, Maryland, to get answers to those vital questions. This is a practically brand new facility, having just opened in 2009. With 275 beds, 7 stories covering almost 600,000 square feet, and hundreds of clinical, administrative, and support staff, Western Maryland Regional Medical Center offers a comprehensive range of health services. And wireless networking, as it turns out, is at the very heart of IT here. Bill Byers is the Chief Information Officer of Western Maryland Health System, responsible for a staff of 30 providing computing, networking, applications, and support for the workforce of the entire hospital. Bill's been involved with WMHC and its predecessors for more than 20 years and has been driving IT initiatives at the forefront of healthcare today, like electronic medical records. The sheer scope and mission-critical nature of his operation are enormous. We asked Bill why mobility is so important to healthcare today.
Well, it's the primary way we deliver our applications to our users, our nurses and our providers that serve the patient here at the health system. We have a number of applications that we integrate wirelessly. We have ASCOM phones that are Wi-Fi phones that our nurses carry. Actually, we have about 500 deployed. It allows us to send alarms from, let's say, bed exit, where a patient gets out of bed. It's helped us reduce our fall rate, having that type of instant notification. A couple years ago, before we actually moved into our new facility, we deployed medication carts, which are essentially custom built for healthcare. It has medication drawers built into them for 6 different drawers. It's a PC, battery operated, and it is completely wireless, of course, and that is the nurse's primary way of interacting with our information system that contains data about the patient. And wireless is very important because we would have to come up with a different way to deliver the meds, take it out of Pyxis, our med stations, get it to the patient, be able to barcode the patient because we're doing bedside medication verification to make sure we deliver the right medication to the right patient at the right time, the right dose. It checks the 5 rights to make sure we're delivering the best possible care we can to our patient.
What about a physician using, say, an iPad or a smartphone, something they would bring in? Are you supporting that as well?
Indeed we are, and that's something that our physicians had asked for quite a while. We have an open guest network so that visitors and patients can access the internet while they're here. Our physicians were using that to use Citrix that we use to give access to Meditech. And they found the performance wasn't that great because of how we rate limit our guest network. So we've set up a secure bring your own device network for our providers that they're using, and they're able to leverage their iPads, their droids. We actually have one physician using an iPhone to access our HIS right from his iPhone, and to be able to not only see results, but even potentially be able to place orders in the near future.
Strategically, where do you want to go with wireless and mobile from this point forward?
Well, I've said it previously whenever I've done these discussions. Wireless, it's part of our DNA here at Western Maryland Health System. We rolled it out under a different vendor at our old hospitals a couple years ago. We learned, we took some lumps on that. We thought we had full coverage. We did not. We had little seams that would cause little dropouts and caused aggravations with our nurses. It actually caused them, I think, to lose a little confidence in the technology we were deploying. For us, it was a big deal. It was a multi-million-dollar investment we were making in software, hardware with the carts. the wireless infrastructure to really be able to access our systems wirelessly, and it wasn't 100% there. So with those lessons learned, when we had the opportunity to move into our new facility in 2009, we worked with Enterasys to make sure we had 100% wireless coverage, and not just coverage, but robust coverage with redundant controllers that we can run. Even if we lose a data center, we can continue to operate seamlessly with our phones, our carts, and we have really demonstrated to our users that we have a reliable, robust infrastructure to support the applications they need to deliver care to our patients.
And we wanted to know if there's anything the wireless network can't do.
There really is not. I mean, we had naysayers that you can't do PACS. We had naysayers that you really can't do the voice recognition, and we're doing it all. We're delivering real-time video images of PACS, cine images from our cardiology PACS. Our physicians are doing the real-time documentation via Dragon to their PCs. There isn't anything that we do on wireless or wired network that we can't do on our wireless network.
We had the opportunity to see the wireless medication carts that Bill Byers mentioned. Microcomputer specialist Carl Hodges explains. All right, now this is a Stinger mobile cart. What does it do?
It's basically a computer on wheels. It allows the nurses to go right up to the bedside and administer medication and work through Meditech is our HIS, I guess, and they come to the bedside. They can use our scanner gun to scan the wristband, which confirms that that's the patient they're dealing with, and scan the appropriate medication. I guess it just brings like the patient care right to the bedside, closer to the patient itself.
So this verifies that the right patient is getting the right medication and keeps all the necessary records.
Yeah, you can say that, yeah.
All right, now I notice it's wireless. This is on the wireless LAN in the hospital?
Yeah, this is on our wireless network, on one of the wireless data, I guess is the network name that it's set up.
So this advance in patient care would not be possible without the wireless LAN that you put in here.
No, yeah, if you hooked an Ethernet cable up to this, you wouldn't get very far wheeling the cart around. So yeah, the wireless allows them to roam all the way down the hall from room to room, and yeah, it's a big part of our mobile computing here at the hospital.
And Nurse Leanne Monday showed us how wireless patient monitoring is simple, reliable, convenient, and productive.
This is one of our portable Space Labs monitors. We use these for any patients who are on a critical drip that we have to maintain and monitor their telemetry, which is their heart rhythm and their blood pressure. We also monitor their oxygen saturation. We have a main computer out at the desk, monitors that this links to, and we monitor them from the desk as well. So anybody that's at the desk has access to see what the rhythm is and how the blood pressure is doing, because we monitor the blood pressures every 15 minutes, every 30 minutes, every hour, depending on what kind of drip they're doing or whether we're titrating it. And then this is portable, so we use it if the patient needs to go off the hall for a test, to x-ray or to CAT scan or anything. If they're on one of those drips, they have to stay connected to the monitor so that we can monitor their rhythm and their blood pressure at all times.
So the patient is always connected?
Yes.
And then this unit is always connected as well through the wireless LAN you put in the hospital. Now, you have coverage for wireless everywhere here?
Yes.
So a patient can essentially be moved anywhere that they need to go for whatever therapy is appropriate. And have you had any issues with connectivity or reliability? Or?
No. We've the module comes out, and so if we're going to switch units, we're going to trade units, like somebody is coding, we have to go to the ICU. We just take the box out, put the box in their monitor, so everything is still stored on there. All of the history is stored, and it transfers over so that they have all of the history from the previous hours.
The Western Maryland Regional Health System has proven that with the right combination of equipment and expertise, the wireless hospital is a reality now. Western Maryland Health Center is a showplace for all of the benefits that mobility brings to healthcare today. Bill Byers really put it best.
If we can do it wirelessly, we do.
For Farpoint Group, I'm Craig Mathias. Thanks for joining us today.